Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today I was going to go over the 5 top myths in plastic surgery.
That was good. It's interesting how you held up 2 fingers to count to 5. Okay, let's go. Number 5.
Am I on there?
Yes.
Since I'm getting flack out there from the peanut gallery, I was holding an implant, so the top 5 plastic surgery myths that we're going to go over and possibly debunk today. So number 1 that I hear all the time for patients coming in for breast implants is that they need to replace them every 10 years. And it's something that's been going on for a long time, and I think it was originated from the fact that the original breast implants many years ago were warranted for 10 years. So a lot of patients had that number in their brain. Doctors mentioned it because that warranty ran out. Didn't mean the implants went bad. Same thing as a car warranty. Anything else doesn't mean they're going to explode or anything bad's going to happen. But the older implants, the shells were different. Obviously, they're much better than they were, 20, 30, 40 years ago. These newer implants have much lower rupture rates, much better implants. And so since then, these implants have now become warranted for a lifetime. Doesn't mean they're a lifetime implant, but it's just now they are warranted for a lifetime. So that 10-year rule really isn't a rule. And even back in the day, it didn't mean you absolutely had to have your implants in place to 10 years. It's just that the warranty ran out. So a lot of doctors at the time recommended, okay, replace them. I'm not saying it was used to redo surgery, but it is something you should have been aware of back then, that the warranty is 10 years. But now, don't fall for that. Unless you're having a problem, an issue, you want to change something, you don't have to replace your implants. Plastic surgery myth number 4 is that women that get breast implants cannot breastfeed. And that's a completely false statement. How do we know that? Because there's a lot of women with breast implants that are currently breastfeeding. These implants have been used for 50 years now, and there's never been any problems with breastfeeding. I think the thing that people need to be aware of in regards to that, particularly nowadays, like I said, when this is a solid silicone implant, is that it's underneath that chest muscle, sometimes above, but still there's breast tissue, everything in between. And that implant, again, scar tissue forms around it, and it's kind of walled off in its own little pocket. The other thing that I think people want to know about breast implant surgery, whether using areola incision, fold incision, armpit incision, even the old belly button incision, is that we're not messing with what I call the plumbing of the breast. We're not messing with the nerves or the milk ducts, anything else in the breast itself. So, because that's a very common question, not only is it safe to breastfeed, but will it affect breastfeeding? And if it is done, again, by a reputable surgeon, the answer is no, it shouldn't affect breastfeeding. There's always a small risk with an areola incision, an areola incision or a lift, but it's very low risk as long as it's somebody that knows what they're doing. So plastic surgery myth number 3. The only way to get a bigger butt is a butt implant, which is false. In fact, I think that butt implants are one of the least recommended ways to augment the butt. And the reason is there's much better ways to do it nowadays, and we're going to go through those. I think the recent attention on augmenting butts has really exploded the options women have. So the old time tested kind of buttock implants kind of fallen out of favor, and these newer things have moved up the ladder. You can still use these, like I said, if you don't have a lot of your own fat, but then you can also combine them with other things and or just do the other things. So you can combine this with fat grafting, you can combine it with fillers, you can do the fat grafting with fillers, and the most common fillers are Sculptra and Renuva. But there's always things coming on the market, so you always want to stay, kind of in the loop on that, because the newer injectables keep advancing. So as we move along, I think we'll see less and less use of these butt implants and more use of the your own fat and injectables. Plastic surgery myth number 2. Because a closed rhinoplasty is scarless, you can't do everything you can with a closed rhinoplasty that you can with an open rhinoplasty. And that's just false. In fact, I think sometimes you can do even a little bit more with a closed rhinoplasty. The difference between a closed and open rhinoplasty is simply the scar across the columella here. Now, the main difference in the approaches is in a closed rhinoplasty, since you don't cut through here, you do everything inside the nostril, inside the nose, you can still lift everything up, see everything, do everything you can do with an open rhinoplasty. Now, with the open rhinoplasty, to get onto the nose, you have to cut through here, cut through the blood supply, the nerves, a lot of things you need for healing of the nose. And you have to go and take apart the entire tip of the nose and get into the bridge of the nose. You can avoid all that with the closed scarless technique. And that's important for a lot of different reasons. Most importantly is healing, scarring, recovery time. And one thing you want to avoid when doing rhinoplasties is a lot of swelling, inflammation, bruising, because that leads to scar tissue, warping in the nose, changes in the nose over time, and a lot of people are unaware of that. And another reason, like I mentioned earlier, that the nose heals faster is because you're not cutting through some of the nerves and blood supply and everything to the nose that it needs to heal. Plastic surgery myth number one, is a plastic surgeon and a cosmetic surgeon are the same thing. 100% false. Absolutely, totally, completely wrong. And the reason is the plastic surgeon is somebody that's trained in plastic surgery, board certified in plastic surgery, and is a plastic surgeon. The reason they made up the term cosmetic surgeon is because that's any other type of doctor that's not a plastic surgeon. Very simple. But why would somebody do that? Why would they make up different terms? Why would they make it slightly confusing? That's really not for me to decide, but I think it's something you absolutely need to be aware of because it's very confusing. I hear this all day long. A lot of patients think they hear the term, oh, he's a cosmetic surgeon. Oh, he's board certified in cosmetic surgery. He was a plastic surgeon. Oh, I trusted him because I saw he was a specialist in some kind of, lipoplasty, fake board thing. And all of those things are not plastic surgeon. The simple answer is that why is there another term? If everybody was just a plastic surgeon, they just say they were a plastic surgeon. Instead, there's this made up term called a cosmetic surgeon trying to do plastic surgery. And I think a lot of the confusion goes back to a very simple thing, which is our licenses that we get as doctors. And a lot of people are unaware that there is much more specialization in a driver's license than there is in a medical license. And every single medical license that a doctor gets when they're out of training says physician and surgeon, irregardless if they ever spent one day in surgical training.
Irregardless isn't a word. Regardless.
Regardless of whether they trained in surgery or not, whether they spent one day in surgery, no days in surgery, everybody gets a license that says that, which I think is somewhat crazy. This license has been the same since, the 1920s and 30s, and nothing has changed as far as the licensing, but vast changes have happened in the landscape of private practice and what is available, how we do procedures. And so I think one other thing people are unaware of is that the landscape of training that goes into plastic surgery, which is that worldwide when students get out of medical school, there's something like 180 to 200 spots in the entire United States to get directly into plastic surgery, whereas there's 36,000 doctors graduating every year. Overall, I'm not trying to preach about it, I'm just trying to say get educated, because if you get operated on by one of these counterfeit surgeons that don't believe in the cardinal rule of medicine, which is first do no harm, and they're more worried about their dollar signs than vital signs, what's going to happen is you're going to end up paying for it in the end. I hope you enjoyed me going over these 5 plastic surgery myths. If you have any further questions, please leave them in the comments below.